2014. What do we need to know in that year, folks?
I'll start with that one. In 2014, several big things happened. First of all, effective that year, there will be what's called insurance exchanges, and these are organizations where private insurance companies can come and offer a product for sale. If an individual is at or between 100% and 400% of the federal poverty level, then they may qualify for some kind of subsidy through the insurance exchange. There will be a regulating of the insurance companies that offer their product, and Karen will talk about that in a bit. But another big thing that happens in 2014 is that every individual who's a U.S. citizen or a legal resident is required to have health insurance. Now, there are some exceptions. There's an exception for hardship. If it's financially unaffordable to you, then there's a provision for having a subsidy and making that easier. If you have religious objections to having health insurance, there's an exception there. I was kind of surprised. My husband happens to be a card-carrying member of the Choctaw tribe, which he's primarily used to get hunting and fishing licenses. But as a side benefit, he's exempted from this. American Indians are exempted from having the health insurance coverage. If an individual doesn't fit within one of the exceptions and they don't get insurance, they're subject to a penalty. It's not a very large penalty. In 2015, it's $325. In 2016, it's $695. And after that, it's indexed cost of living. Also in 2014, large employers, that's those who have 50 or more full-time equivalent employees, are required to provide minimum essential coverage to their employees. If a large employer does not do that, then they are also subject to a penalty. If they have even one employee who goes to an exchange and qualifies for the tax credit, then the employer is penalized $2,000 for every employee they have over number 30. For example, my law office has about 60 employees. If starting in 2014 we weren't providing the minimum essential coverage and one of our employees went and qualified for the tax credit, then we would be fined $2,000 for our number of employees past 30, so about 30. So our fine for that year would be $60,000. So that kicks in 2014. Now, if you are an employer who provides health insurance coverage in that year, you are also required to give your employees a free choice voucher where they can, instead of taking your coverage, they can opt out and go to the insurance exchange and say, I have this voucher here from my employer and I'm going to use it to purchase my insurance through the exchange. Now, the voucher has to be in the same amount that you would pay for their coverage. So if you paid, say, $500 to your employees for their insurance, and somebody opts out, takes the voucher and goes to the exchange, if they're able to purchase their insurance there for $400 instead of $500, they get to pocket that $100. The excess goes to the employee, not back to the employer. So those are some big things that happen in 2014. Karen knows all about the insurance exchanges and how those are going to work.
Oh, yeah. You know, this is going to be an area where I think we're going to continue to struggle with whether each state does create an exchange, because it is up to each state to determine if they want to do that. Health and Human Services will step in for those states that choose not to create an exchange. I'm assuming, based on some information that's available on the Kansas Insurance Department website, that they do intend to operate a state-run exchange. And there are going to be a lot of provisions relative to health insurance companies that want to offer policies to consumers through the exchanges. There'll be very specific insurance coverage parameters they'll have to comply with. There'll also be more of a community rating approach with the premiums that are in these exchanges. And one of the concerns I think a lot of people are talking about is we can look at Massachusetts, for example, and what provisions they've implemented over the last several years in terms of state healthcare reform and the anticipated cost and where it actually is today, and some of the initial premiums as a result of that tend to run lower than marketplace, but also tend to catch up very quickly and oftentimes end up exceeding marketplace. And I think there's a school of thought that the health insurance exchanges, there's a bit of naivety in terms of what all these provisions are going to do to impact cost, and that initially the exchanges may have some very low premiums compared to what some employer plans have in place, and they'll be attractive. The other school of thought that goes along with that is it won't take long for those premiums to also escalate and be similar. Now, the regulatory process will be interesting to see how it plays out in the governance of those premiums and what will and won't be allowed through the exchanges. So that's a big step in 2014, is the creation of the exchanges, and in 2013 the requirement for you as employers to notify your employees of the availability of the exchanges. So that's a huge milestone in healthcare reform. In 2014, just a couple of other things to mention. There is some incentive for employers who are offering wellness programs. Currently, the rewards cap is based on 20% of premium equivalency. That will increase to 30% in 2014 for incentives for your employees to participate in wellness programs. And there is a provision that allows Kathleen Sebelius, as the head of Health and Human Services, to even authorize up to a 50% based on specific criteria, obviously yet to be issued.